Evening, everyone. We will start at 7:01. It's 7:01 now, so I think for sake of time, let's go ahead and get started. Thank you, everybody, for joining us this evening. My name is Catherine Goodman, and I am the Public Relations and Communications Manager for the Blue Ridge Health District. We appreciate you all joining us tonight as we will be sharing updates around COVID-19 booster vaccines and vaccines for 5 to 11-year-olds. I'm joined here today with a few other panelists, Ryan McKay, who is our Director of Policy, Planning, and COVID Operations, Jen Fleischer, who is our COVID Response Project Manager, and Dr. Denise Bonds, who is the Medical Director for the Health District. We will go ahead and get started with slide 1, and thank you in advance to the city who is helping us with all of the technology for tonight. So as I mentioned, we will be going over information about booster shots, questions for information about 5 to 11-year-olds, and then we will be open for question and answer live. So those of you who have joined us on Zoom, please feel free to use the Q&A feature to submit a question live. I will also be going over a number of questions that were submitted in advance, and we received quite a lot. So I appreciate everybody and all of your interest in this, and I assure you that we will provide as much information as we can tonight and have plenty of time for question and answer. And with that said, I'm going to pass it over now to Ryan McKay.
Thank you, Catherine. If we could get the next slide, please. And thanks to everyone for joining us tonight. I know we have lots of information to share. We do want to start with some new information about boosters, which have been approved for Pfizer, Moderna, and Johnson & Johnson. So we, at this point, have been administering boosters for Pfizer for a number of weeks, and most recently, Moderna and Johnson & Johnson. You can see here, we have several locations where we're doing that, including the Community Vaccination Center, Seminole Square in Charlottesville, J. Crew at the Fashion Square Mall until this coming weekend on Saturday, and then we'll be closing that site really to focus on the 5 to 11-year-old vaccination campaign. We still have Moby on the Malls on Mondays. We are at Carter Bank and Trust in Charlottesville on Wednesdays. Local pharmacies have it, and then we are also providing boosters at our local health departments in each of the localities that we serve. So if individuals had received a Pfizer or Moderna, they are now eligible for boosters if they meet certain criteria, and those are listed here: 65 years and older, 18 plus who live in long-term care or congregate settings. These are individuals who are at risk based on their living situations. And then individuals who have underlying medical conditions and those who work or live in high-risk settings. Part of that criteria is that individuals are 6 months beyond their second dose. And you can see on the right side there's a nice little chart about when you can receive your second dose based on, or your booster dose, based on when you were fully vaccinated. For individuals who receive Pfizer or Moderna, you can get either Pfizer or Moderna or a J&J dose. And then individuals who receive their J&J dose as their only dose, the individuals 18 and above are eligible, provided that it's been 2 months since they received their Johnson & Johnson and they're 18 and above. Third doses are really for individuals who are immunocompromised, and it's been at least 28 days since they received their second dose. And this is really specific to those who received Pfizer or Moderna. Again, boosters are available throughout the district. There's no rush to get them at the 6-month mark. There is time, so if you're having difficulty finding an appointment, it's not necessarily needed right at the moment that you're 6 months out from your second dose. Next slide, please. So we are going to spend the rest of our time focusing on the vaccination campaign for 5 to 11-year-olds. Later on, Dr. Bonds will describe sort of the processes where we are now at the federal level in terms of emergency use authorization for this age group. I want to start by focusing on what our goals and priorities are. Some of this relates to the pandemic in general, not just the vaccination campaign, but what we've done to contain spread and transmission throughout our communities. Really, the overall goal here of the vaccination campaign and the response in general is to reduce the opportunity for the most severe outcomes, meaning hospitalizations and death. We're also trying to reduce transmission and spread of COVID-19 so that it has a minimal impact on social and economic needs throughout our community. Meaning, are we preventing spread and reducing risks so that individuals can maintain their livelihood and their life status within their social settings. Now, thinking through this in terms of how it applies to the vaccination campaign for 5 to 11-year-olds. The rollout of this vaccination campaign is going to be slower than we would like. We would love to provide thousands of doses every single day to offer some level of protection to children throughout our communities. And that's just not really going to be possible. And so we're trying to, what we want to do is communicate what things that are happening right now to reduce risk, what we've been successful at with our community partners, and certainly individuals across the district. And then what we're doing to provide equitable access across our communities to make sure that we're providing individuals with, or removing barriers for individuals to get access to those vaccines. So first, thinking about minimizing risk. Obviously, children 5 to 11 years old have been in school for several weeks now. And what we've learned over the past month and a half to 8 weeks is that risk within school has been minimized by the activities and actions from the schools themselves, and certainly by parents and guardians who send their children to school. Of over 1,600 children who have been identified as a close contact in school settings since late August, only 3.3% of those children have actually converted to a positive case. And a lot of those situations have been corrected in terms of how they were exposed. So thinking about those situations, they include lunchtime activities where individuals, children are in a classroom setting with their masks off and eating. Bus situations where children may have been too close together, or we're unable to identify those who are truly exposed. And by adjusting and correcting some of the things that we learned that were creating exposure risk within schools, schools themselves have made adjustments and have been very successful at minimizing spread across the school district. And thinking a little bit more about equity, we recognize that all children are vulnerable. There's activities that are happening both inside school and outside school that are going to create risk. But we really want to emphasize that the access and distribution of this vaccine really has to account for individual children who have underlying medical conditions, who are at greater risk for hospitalization or the most severe outcome, death, if they were to contract COVID. We also understand that children may be in living situations or situations themselves where they would expose others who have underlying medical conditions, are part of a severe risk group who may have the worst outcomes. And so providing access to the vaccine to these children is critical, not just to themselves, but to the individuals that they live with or the people that they live near. And then finally, in regards to access, with a limited initial supply, we want to reach as many neighborhoods and as many areas of the health district as possible, distributing the amount of vaccine that we're getting to all of our communities, and as an opportunity to remove barriers for those who historically have had the worst outcomes related to COVID, or barriers themselves to receiving particular healthcare. By removing these barriers and distributing the vaccine across the district, as opposed to asking people to come to centralized locations, we believe that this is the greatest opportunity to get the most people or the most children access to the vaccine that also prevents risk to others. With that, I'm going to turn it over to Dr. Bonds, who will explain a little bit more about the approval process and where we stand with the vaccine, and describe what our allocations are going to be in the coming weeks.
Thank you, Ryan. If I could have the next slide, please. So just yesterday, the FDA Vaccine Advisory Board, affectionately known as VRBAC, approved or issued a recommendation that the Pfizer-BioNTech vaccine be used in children 5 to 11-year-old. Next, we need the FDA to approve that recommendation from their advisory group. And then the CDC advisory group will then meet next Monday, that's already scheduled for November 2nd. And they will also review all of the evidence and issue their recommendation. Once the CDC advisory group issues their recommendation, the director of the CDC, Dr. Walensky, will then either accept or reject that recommendation. And we have no reason to believe that she would reject it. And then at that point in time, we can begin to administer that vaccine. Our plans, because we will have a smaller allocation than we would like, at least initially, is, as Ryan described, to vaccinate those high-risk children first. And we'll do that in conjunction with our schools and with our pediatricians in our area. We anticipate that we should be able to begin vaccinations sometime around November 9th. Those vaccination sites, as I said, will be in schools, pediatric offices, and some neighborhoods. And we'll be doing this primarily through drive-through areas, drive-through clinics throughout our district. Can I have the next slide, please? So both Ryan and I have said there's a fairly limited initial supply of the pediatric dose. And I think it's important to understand that this is not the same dose as adults are giving. This is 1/3 the dose that both children 12 to 15 and then any individual 16 and over are getting. And we can't dilute it down, unfortunately. We can't take an adult dose and dilute it down to the pediatric size. We must use the pediatric doses on the 5 to 11-year-old. So the health district will be receiving 6,300 doses for the first 3 weeks of this campaign. We will be distributing those through school drive-through clinics, some neighborhood clinics, and then pediatric and family practice clinics throughout our localities. And we are also responsible as the health department to provide vaccine to the community vaccination center that's located in Seminole Square. And so they will also get a portion of the pediatric doses. There is a separate allocation that goes to the University of Virginia Hospital. And our understanding is they're getting 6,600 doses also for those first 3 weeks. Our understanding of their plan is that they will distribute those throughout their health system offices and will continue to do the homebound vaccination program that has been so successful and is such a great joint venture between UVA and Charlottesville Fire Department. There is a separate federal allocation to pharmacies. We have not been told what that allocation is, and not all pharmacies will receive doses. So if you're going to choose that route to get your child vaccinated, you really need to check either with the pharmacy that's near you to see if they have the pediatric doses, or go on vaccines.gov and see if that's one of the options available at your local pharmacy. Can we have the next slide? So we've talked about prioritizing kids that are at high risk, and I see that one of the questions in the Q&A is, how do you know if your child's at high risk? And so the graphic that you see on the right-hand side of the screen is from an observational study that was actually just discussed yesterday at the FDA VRBPAC advisory meeting. And what they did was look at all children 5 to 11 who had been hospitalized with COVID-19 from March until August, really for the length of the pandemic at this point in time. So there were 560 kids that they were able to obtain medical records on. And you can see that there's a slight tendency for boys to be hospitalized over girls. And then if you look down during the race and ethnicity, as we saw in adults, there's a higher preponderance of people hospitalized for COVID who are Black or Hispanic. And then a large portion of them had another underlying condition. And the bar graph to the right there shows what those underlying conditions were. So chronic lung disease, so children who are young and have some sort of lung disease, as you would expect in a disease that causes lots of problems with breathing, is going to make you more likely to be in the hospital. Obesity also was seen more frequently in those children, or had a high prevalence in children who were hospitalized. And then other neurologic diseases also resulted. And then there was a scattering of other ones. So if your child, going over to the left-hand side of the screen, has lung disease or is obese, has some sort of underlying neurologic disease, a blood disorder, or has some sort of immunocompromising condition, either because they're taking a medication or because they are undergoing chemotherapy or have chronic metabolic disease, all of those conditions would put them at higher risk of having a really poor outcome if they got COVID-19. And so those are the kids that we really want to get vaccinated right away, because we want to keep them out of the hospital. And then as we see in that table, there are some demographic conditions. The hospitalization rate are considerably higher for non-Hispanic, Black, American Indian, and Hispanic children as compared to non-Hispanic white children. And then, of course, as we've already said, if the child is in a household where other family members are working in positions or out in the community in positions that might put them at very high risk of contracting COVID and then bringing them back home to their kids, that also puts them at high risk because of their environmental conditions around them. So, Catherine, I'm going to turn this back over to you.
And we will have Jen present next. And I see one of the chats in here asking about how many 5 to 11-year-olds there are in our district. And what we have calculated is about around 15,000. And Jen can talk next about how we will vaccinate them. And next slide, please, Joe. Thank you.
Thanks, Catherine. Thanks, Joe. So yes, we have roughly 15,000 kids within the districts. That's all the localities and Charlottesville and Albemarle. And we've begun the planning with our community partners and pediatricians and with community members like yourself. We have sent out an anonymous survey in order to gauge your family's intention for getting their 5 to 11-year-olds vaccinated, as well as to understand where they were more likely to bring their children to be vaccinated. So that survey is accessible via a link on our website, as well as this QR code in the slides, which you'll be able to access. And that really helps us with understanding where and how much vaccine to bring to the clinics. We're asking that that survey is completed by November 4th, and we'll continue to circulate it in multiple languages outside of English. The way that we will schedule 5 to 11-year-olds for the clinics are via appointment only. So appointments will be open in our current VACE system. So the same system that we use for adult doses and have been using all summer long will also be used for the 5 to 11-year-old vaccine clinics. So that we anticipate that VACE system will be updated with the pediatric questionnaire and consent forms by November 8th. And as Dr. Bonds mentioned, we anticipate beginning clinics November 9th and moving through the holidays. So all of those online registration process include the consent and the medical questionnaire. And we're asking to complete those ahead of time because it's crucial to our efficiency on site when operating the drive-through clinics, and when with our limited supply per site, we really have also limited time to get through those clinics. So in having all that prepared and having an understanding of how many children will be vaccinating that day, it really helps the flow and fluidity of those sites, which hopefully makes your experience even better while you're there, and your kids as well. I got lots of lollipops, so many lollipops. So the last piece is the locations where we'll be hosting these. And we are predominantly doing drive-throughs, as Dr. Bonds and Ryan mentioned. So we've chosen this method of vaccinating because it offers us the most mobility to different neighborhoods and schools in order to offer not only a private space for the children, but an easier method for families to kind of get in and go and get vaccinated and carry on and celebrate vaccination, at the ice cream shop after. So clearly I'm not in charge of diabetes or obesity at the health department. So the piece of having folks come in and check in and move through the flow and get vaccinated and have questions answered, and then still the 15-minute observation time is in effect for the 5 to 11-year-olds. And then after observation, carrying on, we think will offer more families a chance to have a positive experience as they move through, and also kind of have little tiny clinics that are just private for that family enough to have a very easy experience. So those locations for drive-throughs will be predominantly at school sites. And we've chosen these schools with the help of school administrators and heads of school and principals and administration for their capacity and offerings to children who are in high risk situations, particularly from the environmental standpoint. So schools that are serving kids that have family members who are public facing jobs all the time or live in multi-family units or with elders, and schools with children who are on reduced or free lunch, indicating that they may also live in a situation with parents who are working many jobs and thus public facing. So with the help of these administrators, we've narrowed it down to the first wave of schools that we'll visit with these first 6,300 doses. And if school sites are too small for a drive-through, a fluid drive-through clinic, then we'll host a drive-up clinic with our mobile unit. And that's similar in that you'll stay in your car, but the vaccinator will come to the car, or the unit is an option. And some kids really like to get on the truck and visit Moby, and we have nice small private clinics on the mobile unit. And we hope that in those situations that we'll just have a kind of a park and go scenario for vaccinations for children. So the other two locations will be neighborhood pop-ups with the assistance of our mobile units. For example, we'll be visiting neighborhoods that have community centers already as part of the housing complex. So we'll use both the community center and Moby to vaccinate children so that they have a quiet, private space with their families to complete their vaccination. And finally, the Seminole Square, the CVC next to Marshall's, will have also some private rooms, but we'll be offering those 5 to 11-year-old vaccinations in that larger setting. So the advantage of the CVC is that its hours are very generous. They're open Monday through Saturday, 10 a.m. to 8 p.m. Additionally, if your household contains 2 children who are 5 to 11 and 1 who is 12, so their vaccinations are different. As Dr. Bond said, they are 2 different doses. Everyone can be vaccinated at the same time at the CVC, whereas at our drive-through clinics, we will only be servicing 5 to 11-year-olds. At our neighborhood pop-ups, some have a blend, but most are purely for 5 to 11-year-olds. So that's our plan. We have enough vaccine to meet demand for smaller sites. So again, we won't be doing 1,000-person drive-throughs at any of these sites. We're hoping the range will launch somewhere between 50 and 300. In the survey, which we hope you'll complete by next Wednesday, we'll have a better idea of which sites need more support and larger clinics and which sites would need smaller support and fewer clinics. And so we'll finalize those sites with the schools and their administrator in the coming week. Joe, may I have the next slide, please? And that is all. So we'll open for questions, and I'll take it back to Catherine.
All right, thank you all. So we're already receiving quite a few questions, and I appreciate you all submitting those. As a reminder for folks who just joined, please feel free to submit the questions in the Q&A feature on Zoom. For those of you who are asking social media questions, we do have staff who are monitoring that, and we'll be submitting those on Zoom as well. And we're also looking at all the questions that were submitted in advance. So we are here until 8 o'clock. We have a lot of questions to go over. We will try to provide as much information and answer as many questions as we can. If we are not able to get to your question tonight, feel free to email us. It's listed on this slide. It is brhealthdistrict@gmail.com. This email account is monitored frequently, and we will be able to respond to you or connect you with the resource that you may need for further information. So, and I will also mention, we do still are operating our COVID-19 hotline. That's the 434-972-6261. And that is operating Monday through Friday from 8 a.m. to 4:30 p.m. We are experiencing quite an increase in call volume. We are hiring additional staff right now. So again, if you can't get through to us, you can always send us an email. And then this website listed on the screen, vaccines.gov/search. That is a great website to go to find all of the vaccine resources and where you can get vaccinated. For example, we talked about pharmacies earlier, and we may not know just yet which pharmacies will receive vaccines for 5 to 11-year-olds, but this is a website that you can use to search for where the vaccines are available in the district. So with that said, I am going to go ahead and ask some of the questions. We've received a number of questions around specific medical questions. I will ask a few of these to Dr. Bonds, and then I will share if you have specific questions about certain conditions. What we recommend is that you talk to your pediatrician. I will put a link in here on Zoom, and we can share that on social media as well to the CDC website, where individuals can find the list of what qualifies someone as higher risk for COVID-19 right now. And then again, speak with your pediatrician as well. But I will get started in asking Dr. Bond. So couple of the questions submitted in advance, one of them is, if a child has an allergy to eggs, is the vaccine safe?
So yes, this vaccine, and that differs from the flu vaccine that we use every year. So the COVID vaccines are not an egg-based platform. That is, they're not grown in eggs, they don't use eggs. And so it's perfectly safe if you have an egg allergy to receive the vaccine.
Great. Thank you. All right, another question, and this actually, we had a few people ask this on different ends. So I have a child who turned 12 and they're small build. Will they have the option for their child to receive the 5 to 11 vaccine?
So at this point in time, we don't know what the recommendation will be to the CDC. Because this is an emergency use authorization vaccine, we are required as the health department to follow the CDC recommendations. And I'm sure that will be provided when they actually approve the vaccine. When the vaccine has full approval, then your own pediatrician has more latitude on what to do at that point in time. Talking about that same thing, I know that there are some parents going, but wait, my child's going to turn 12 before they get their second dose. What's going to happen at that point in time? So you have a couple of options. You could just wait the few weeks until your child turns 12, and then they'll get 2 of the adult-sized doses, the 0.3 international units, or you could start with the lower one, and then when they do turn 12, 3 weeks later, go ahead and get the adult one.
Great, thank you. And then a few other questions around this age limit. One of the questions from someone on Zoom says that their children are almost 6 years old, but they are small in size. So they're almost the size of a 4-year-old. Is it safe for them to get the vaccine when it's approved for 5 to 11-year-olds?
Yeah, the vaccine is not weight-based, so we don't change it based on the weight of the child. It's really age-based. And the clinical studies included kids all the way down to age 5 and included kids that were a whole variety of weights. And so there really is no minimal weight as long as they meet the actual age criteria.
All right, thank you. Just a few other more medical driven questions here. So one individual submitted in advance that despite their best efforts, their child had COVID about a month ago. Should they wait to get the vaccine? Should they get it now? What do you recommend?
Yeah, I would probably wait at this point in time. Your child has some natural immunity at this point, and we think that natural immunity lasts for at least 90 days. And so you could delay getting your child vaccinated. I will say this initial bolus that we're getting, although it's limited, we have every expectation that there will be more doses coming down the road. And so people shouldn't panic about getting vaccine. There will be plenty of pediatric vaccine. It's just in this initial rollout, just like if we remember back, there was limited adult vaccines early on until the production got up to the correct amount.
All right, thank you. And one more age-related question. So if a child's about to turn 12, do you recommend they wait to get the vaccine in a month from now when they're 12, or should they get it when they have the opportunity if they're 11 years old?
Yeah, I think that depends on your child's circumstances, and it might be something you want to talk with a pediatrician about. Does your child have one of the high-risk conditions that would put them at risk of becoming hospitalized if they did come down with COVID in that month before they turn 12? Is there an environmental factor that might put your child at higher risk? Those are all things that you have to consider, and really your pediatrician is the best person. There is a difference between the 5 to 11 dose and the 12 to 15 and adult doses in terms of the amount that you get as via vaccine. And so that's just a consideration that you should talk to your pediatrician about.
All right, great. And I will put in the chat now for everyone who is on here, the link again to the CDC website for high-risk individuals and that information. We will also share that on social media. And when we send out this information, we will post that as well. So we also, now turning over to the vaccine supply, we've got a number of questions about that. Folks want to know first, what is the VACE system? I will ask Jen these questions. So can you explain to us what VACE is and remind us of how and when individuals can sign up to receive a vaccine, or how parents or guardians can sign up their children to get a vaccine?
Sure thing. So VACE is an online browser-based system that asks a few demographic questions, name, address. It's helpful to put in phone number and email if that's available, as the system will keep track of your appointments through your preferred communication method. And then it allows the medical questionnaire to be reviewed within 48 hours of the clinic. So really trying to find out if your child has any COVID symptoms that we want them to delay getting their vaccine, and to make sure that there aren't any contraindications to them getting the vaccine at the drive-through clinic. So just as an aside, the VACE questionnaire, we anticipate it being pretty thorough, but the drive-through clinics are really intended for children who don't have any medical contraindications, don't have any allergies. They really can just dose and go. So if your child does have any complications with receiving vaccines, or has a difficult time receiving vaccines, we really recommend that you go to your pediatrician. So we are partnering closely with 2 pediatricians in the Charlottesville-Albemarle area who have really robust, large client base for the 5 to 11-year-olds, and in particular have also a very good support for a lot of Medicaid patients. And we're not only supporting them with vaccines so that they can service you should the drive-through clinic not work for you, but also so that they can support you on regular kind of clinic days in clinic, and in we're supporting them with staffing to help them run larger clinics. Now, both of those larger clinics, they will offer drive-through clinics, but again, if your child, that doesn't work for you, having it in the pediatrician's office or something like the CVC might be another option. The CVC, because it's park and go in, is also using, and is part of the VDH system, is using the VACE system as well. So it's not that the system will vet anyone out or keep you from completing an appointment if you answer questions incorrectly, but it will, the more prepared that pre-questionnaire and that whole appointment is completed, the faster the visit on the ground when you do come to your drive-through. Finally, the VACE system will allow you to choose your appointment time, which we will, try to accommodate as accurately as possible. And then it will confirm the appointment via text, if that's your method, or email. And that can be rescheduled through that same system. It is available in Spanish. It's currently being worked on in other languages other than English and Spanish. But you can always reach out to the BRHD, to our Gmail that Catherine mentioned, or to our hotline, and we can help you register for that dose. Know that the first few clinics, because we're helping to identify kids who are most at risk, and we'd like them to be prioritized for this first wave of vaccinating, with the help of their schools and their pediatricians and their community members, that some of the clinics will have limited offerings or may not be publicly shared. The CVC will have the most publicly offered listings of clinics. So you may, for example, know that your school is hosting a drive-through on Friday, but not see that in the VACE system. That's because it's a clinic only for that school and its surrounding neighborhoods. But the CVC will be available and viewable, and appointments will be able to be made, as it will continually be an open clinic to all folks in the district. So I hope I answered that all right.
Yes, you did. Thank you. And while you're talking about these drive-through sites, do individuals, if their child goes to a certain school where we are vaccinating, or if they don't go to that school, can they still get vaccinated there? If that makes sense.
Yeah, so some schools are partnering with other schools. And again, I can't pitch that survey enough. Go ahead and tell us where. There's neighborhoods listed on the survey, there's schools, there's libraries and community centers. So give us an idea of where you want to go, and that will help us know, how to plan. But if a school that's is having a clinic early in the cycle, so closer to November 9th than say Thanksgiving, and you're worried about getting an appointment, again, check the CVC first, but know that there are multiple schools. I think we're servicing over 30 schools in those first 3 weeks. So it's likely that either your nearby school is partnering with one of the school sites or community-based sites, or that the CVC is your best option. So you kind of want to stay in touch with your school as we begin to help them market and spread the word and get appointment slots to them. And also reach out to us. If a place on here listed in the survey is not close to your proximity or difficult to access, let us know. And we are open to those suggestions.
All right, thank you so much. One other question, talking about the school clinics. If they have multiple children that are eligible, can they get them both vaccinated at the same clinic, or do they need to go to different sites or schedule separate appointments?
So that's a great question. We are anticipating siblings and siblings who don't attend that school to arrive with their families. So we are absolutely prepared to vaccinate whole families in the car in the drive-through. Again, the only kids in that family who we can't service are those 12 and older. So as long as you can pull up in a van with 10 children, that's fine with us, but it might take you a moment. So as many under 11, 5 to 11s that we can take care of, we will.
Great. And just to clarify, all vaccines for 5 to 11-year-olds at this point will be by appointment only through the Blue Ridge Health District. Individuals can contact their pediatricians to ask for more information about how their pediatrician will be offering vaccines, how to maybe get on their list for a vaccine, and how they would have to register through them. But for the Blue Ridge sites, they are all by appointment only.
Yeah, and Catherine, just to jump in again, 1 second, that if your pediatrician is carrying vaccine, they may be carrying a very small supply for this first wave. So it's really worth it to check with them and find out if they'll have vaccine available in clinic, or if they are planning on hosting a small site at like a drive-through or a walk-up, and just see what's available so you can navigate the appointment terrain to your advantage.
Great, thank you. All right, and we also have a few school questions that were submitted in advance. So I'm going to switch over to Ryan and ask you a few things. A lot of these are asking about masking policies and what that looks like once kids are vaccinated. Can you talk about that and provide information for us there?
That's a really good question. So what we know is masks have proven to be one of the most effective mitigation strategies when we combine that with others. So distancing, making sure that we're doing sort of screening checks of our children before we go to school, and then with the schools, working with them to ensure that all those strategies are put in place. So it is a critical part, particularly for those who are unvaccinated. I think right now it's a little difficult to determine when mask policies within schools can be lifted. It's going to depend largely on the vaccination rate within that particular school, and then what local transmission looks like throughout the community. So it's kind of difficult to forecast when that may happen and where it's going to start first. But I think those are the considerations that we have to account for when thinking about policies related to masks in schools.
All right, thank you. And then do you have any insight, and this may be something we have to follow up with the schools and provide more guidance as it depends on school district, but any insight on how quarantine or isolation policies may change once students are vaccinated?
For students who are fully vaccinated, if it's potential exposure, they don't actually have to go into quarantine. What we would ask is that they monitor for symptoms, and then 3 to 5 days after the exposure, they get tested just to make sure that it is negative. For students that are unvaccinated and they are exposed, they will have to follow either the recommendations from the health district, which we recommend 14 days as the safest route, or check with their schools to determine what the quarantine policy is, whether that's 14 days, 10 days, or 7 days with a negative test that was taken on the 5th day after exposure.
Okay, thank you. This is lots of great questions in here still, so I'm trying to organize and get through them as much as we can. So let's flip back over to talking about the vaccine rollout. We have a few clarifying questions. So we shared earlier, and we've shared on social media, that we have our allotment for the first 3 weeks, excuse me. Can one of you share what that allotment looks like after those 3 weeks and what our plans are for that time? And I will actually just call on Dr. Bronze to answer that.
Yeah, so the state will continue to get vaccine every week as we move beyond that initial rollout. And we anticipate that we'll continue to get vaccine here in the health district, both for us that we'll share with our pediatricians and the community vaccination, and then UVA will also continue to get its own allotment. We think that certainly as November progresses and we move into December, we should have plenty of vaccine for anybody who wants to get their child vaccinated at this point in time. So we're asking for just a little bit of patience at the beginning because it will be more limited than we would like it to be. As I think Jen said, we would love to have thousands of doses and be able to vaccinate everybody immediately. That's just not going to be possible. And so we just ask for a little bit of patience as we move forward. Remember, there are still lots of things that you can do to mitigate your child's risk. Schools have proven to be extraordinarily safe and very low risk of transmission. I think our schools are doing a great job of keeping our kids safe. And so I would continue to do all those great things that you've been doing and just have a tiny bit of patience and we'll get all the kids vaccinated.
Great, thank you. And then can you also provide us with some information on second doses? What will it look like? What are the current recommendations for if an individual, is it like adults where we have to get 2 doses if you get Pfizer or Moderna? Tell us more.
Yes, so you will have to get a second dose, or your child will. And the recommendations will likely be the same, about 3 weeks after the first dose. And so our new scheduling system will have appointments available for those second doses, and you can schedule them at that point in time. And then that would be it for the foreseeable future.
Okay, and then just remind us again, Dr. Bronze, a few questions followed up in here. So if CDC approves of this on November 3rd, can we start vaccinating 5 to 11-year-olds on the 3rd?
No.
Okay.
So just to go over the process again. So the FDA first has to approve it. Their advisory committee has recommended it, but we don't have the FDA approval. At least we hadn't before we went on air. The CDC advisory committee meeting will meet on the 2nd. That's Monday or Tuesday, I think. And they will make their recommendation. And then that has to be adopted by CDC. And the vaccine has to actually arrive in our health department to our little freezers here and be available for us to use. And we, as a health department and a state agency, have to have the approval of our local state, although they usually do it as quickly as the CDC does. So it won't be available on the 3rd, the day after the CDC advisory committee. Really look for those first vaccines to be available the following week. But the appointments will be there shortly. You'll be able to make an appointment, which will make sure that your child has a slot.
Great. And with the new VACE system, I've put the link in our chat here. I will have our social media coordinator put it on social media as well. And I will answer your questions in the Q&A with that link too. But can you tell us, when individuals schedule an appointment through VACE, does it automatically schedule their second dose appointment?
Good question.
And Jen, thank you.
Yeah. So to add on to what Dr. Bonds was saying, we won't actually have VACE live with the correct 5 to 11-year-old questionnaire until Sunday night, the 7th of November. So that is also one of the limiting barriers for us to actually distribute vaccines. So we just need that technology to catch up, and they move very quickly and accurately. So we're anticipating that they'll make that deadline, and then we'll be able to vaccinate at that point. So you won't be able to make an appointment until the 8th. That's when the 5 to 11s, you'll see all those clinics, and they'll be listed. The open clinics, particularly the CVC, will be listed as they are now in order. Once you receive your first vaccine, or your child receives their first vaccine, the observation area will be used for scheduling the second, but not to fear. If you pull away and have not scheduled your second, the system automatically pushes a notification at 6 p.m. at night, and we'll assume that will stay put for 5 to 11-year-olds to nudge you to schedule your second dose appointment, which will generally be at the same site that you got your first, just for ease of scheduling and availability of sites at that time when the 21 days later.
All right, thank you.
I just want to jump in here because I've seen the screenshot of how it's going to look when you register in VACE. And remember that you have to pick the right appointment, the 5 to 11, because it's a different dose than the 12 to 15 or 16 and above. So it's really critical that you make an appointment for your child with the right dose. So read carefully.
And we'll help with that too, because for most of those drive-through, well, all of the drive-through clinics, they will only be offering that one dose. It would be more of a confusing factor at the CVC. When you look at that, they're offering the Moderna, the J&J. If you sign up for the wrong adult dose and you really need a child's dose, that would be either impossible for you to get your child vaccinated that day because the allotment will not be there to switch you out of the incorrect clinic. So, that's when on the CVC itself, make sure that you choose, and it's very well marked, 5 to 11-year-old Pfizer.
Great. All right. And then we have a few questions asking about the actual vaccine sites and where we will be hosting these. So my couple questions for you, Jen, and I could probably answer this, but I'll ask you is, will we be publishing where all of the sites are scheduled? And if a child, how will people learn about these sites? And then will they be out throughout the entire district? Like, will we have some in Louisa and our other surrounding counties?
Yes. So I'm very excited about this because I want to learn everyone's mascot. So we will be at all throughout the district in the first 5 days, and I'm just going to check my cheat sheet. In the first 5 days of vaccinating, we aim to get to every locality: Louisa, Green, Nelson, Fluvanna, as well as Albemarle and Charlottesville neighborhoods. So we are running multiple drive-throughs, at least 2 per day for many of the days. They are almost all evening clinics or weekend clinics on Saturday and Sunday. So they're almost all 4 to 7 p.m. at night or 9 to noon on a weekend. And then the pediatrician clinics that we'll support have similar schedules planned for their weekend clinics as well. So we probably will not post every single site that we're going to, in that the majority of those clinics will be closed. And so the way that students at that school who, administration and teachers and parents have helped to identify, needing prioritization for vaccination, will get the announcement for that clinic and be given the link into VACE to register for their appointment. And then it will broaden out to the full school population. So again, some schools have, hundreds of children who might be eligible. And obviously we can't service each school with those quantities of vaccine right now. We will shortly, as these first few weeks roll out. But you'll hear about it from your school administration newsletter. And we're also supporting them with marketing materials and other kind of PR pieces so that word can really get out that those links are available and live. And then the CVC, again, will just be live. So the schools, you'll be able to see those on all the sites right away.
Thank you. A few more questions as we go. We have about 10 minutes left. So as a reminder, if we are unable to answer your questions today, please send us an email and we will get back to you this week and respond as quickly as we can. So Jen, one more question for you. And what time will VACE be open with appointments on November 8th? So we don't want this to be like the spring all over again. You know, we have learned from that time. It was quite a time for all of us in January and February when the vaccines rolled out. We don't want folks sitting behind their computer. Bear with us as we do this transition and open up these vaccines, but just can you give us that information, Jen, in case folks want to wait?
Sure. I would love to, but they don't let us know, I think for that very same reason. They're trying to protect us from the onslaught of knowledge, but we don't know yet. We just know that it's proposed and planned to launch on the 7th, so that by the 8th, and if it's midnight on the 8th or 9 a.m., we will absolutely announce district-wide social media channels, probably a newsletter on our website. Hey, 5 to 11s are online, go for it. VACE link is here. And again, we recognize that it is a very responsive application. It works well on phones and computers and tablets, but we recognize that that's not the best method for everyone. So it really is available if any assistance is needed to call in or email us, and we can assist you with getting that appointment. I think, and it will, it runs 24/7 once it's open. So number counts are accurate and appointments are accurate.
Great, thank you. And as a reminder out there, we haven't actually mentioned this today, but COVID-19 vaccines are free for all children. They are free. So remind that and tell all your neighbors and your friends. So they are free. And Ryan, can you talk to us? You talked briefly about the rollout for this and how we want to keep kids safe within schools. So we also talked about how we want to vaccinate higher risk kids first. That's not a requirement or mandated, but talk to us about how we can work on this rollout together.
It's a really good question. I do think it's important for parents who have children that fall into those categories to really work with their pediatrician's office or their family practice to determine whether or not those offices are going to administer vaccine, what they think their timeline is going to be to do that, and try to coordinate with them first. Hopefully, children who are high risk based on their medical history already have a pediatrician, and really that's going to be the strongest route for individuals to go to try to get vaccine for their children in those situations. Obviously, the CDC is another option, and then through the schools, as Jen described. But really, those are the conversations that hopefully parents and guardians have been having with their pediatricians all along in terms of how keeping their children risk exposure extremely low, and then what options they have for getting their children vaccinated through the pediatrician's office.
All right, thank you. Okay, and then for the last few minutes, I want to ask Dr. Bonds a few questions about the safety among the vaccine among 5 to 11-year-olds. Why don't you go ahead and share with us how safe the vaccine is, why we believe it's safe, and encourage 5 to 11-year-olds to get it?
Yeah, so there were 2 clinical studies that really formed the basis for this emergency use authorization. The first study had over 1,500 individuals, children, who got the actual vaccine, and they were compared to 750 individuals who got placebo. The second study, 1,590, almost 1,600 kids got the active vaccine, and another close to 800 got the placebo. They looked at responsiveness 2 ways, whether they developed antibodies and then how many kids got COVID. And it really showed very high antibody levels, equivalent to what you'd see in the 12 to 15-year-olds, and only 3 cases of COVID in all the kids who got the active compared to 16 who got the placebo. It was very safe. Kids generally did really well. A little bit of fatigue and headache were really the 2 risk factors that were noted. So children are very resilient, and they often handle things much better than adults do. So I think parents should feel very comfortable and safe giving the vaccine. If you have any concerns because of your child's medical history, the best person to talk to is your pediatrician.
Great, thank you. I'm looking through to see what other questions. We have a handful of things. Again, if we aren't able to get back to you, please send us an email. We will follow up with you soon. Can you just remind us, again, we're getting a couple questions about the number of vaccines. So we have about 6,300 vaccines coming in for our first few weeks. We know there's roughly around 15,000 children that want to be vaccinated or could get vaccinated in that 5 to 11 year age range. And so we'll be working as quickly as we can to get everybody vaccinated who wants them. The other only quick questions we're receiving, we have a lot of them, so trying to kind of sort them through, is about individuals whose parents work in front lines and how should we be notified of that. So if someone believes their child is either at a high risk based off their medical condition or off of their environment with where their parent works, how should they let us know? And Ryan, I think we talked about this before, if you want to share with us.
Well, again, I think working through pediatricians is going to be the best bet. Again, there's no mandates for what we have to follow. We're trying to recommend as best we can how vaccines should be prioritized, the location of where we're putting our drive-through clinics, and those decisions made in conjunction with our schools based on the data that we have, and try to use in our mobile efforts since the spring. Will also provide opportunities for individual parents to get appointments for their children. So it could be through the pediatrician's office, understanding that we are making neighborhood-based decisions on the data that we use to reach out to communities over the course of the spring and the summer. So there's going to be multiple avenues for how those individual parents or frontline workers can try to access the vaccine.
All right, thank you, Ryan. And we have provided a lot of information about 5 to 11-year-olds. We're going to wrap up with just a few more minutes of information about booster shots, and then we will wrap up tonight. Again, you can give us a call or email us for more information. And Dr. Bonds, why don't you talk about booster shots?
Yeah, I just want to remind everyone that boosters are now available. If you got a J&J, it's actually really important that you get a booster, and you can pick whichever one you want. You can get another J&J, or you can get one of the mRNA vaccines. It did get pointed out tonight that now mental health and serious mental illness is considered a high-risk condition. And so if you or a family member suffer from a mental health condition, you should really think strongly about whether a booster is appropriate. And again, really the right person to ask about whether or not you qualify for a booster is your family medicine doctor, your healthcare provider. They can really help you sort through what your condition is and help you decide. And they can also help you decide what is the most appropriate booster moving forward. So just want to make sure everyone understands that those are available right now. I saw questions about caregivers of kids and how they can get vaccinated. You can go and get vaccinated right now at the community vaccination center. They are taking appointments and they will take walk-ins.
Great. Well, thank you all for participating tonight. We appreciate all of your questions and your interest in this. Again, I know there's a lot more questions that we weren't able to answer. I will put our email address in the chat again. So if you have other questions we couldn't address, please send us an email. We will follow up with you as quickly as possible. Our hotline is also available Monday through Fridays. And again, we appreciate your interest and we will continue to provide more information. This webinar will be recorded and we will send out that link along with some of this information and updates tomorrow through our newsletter, and we will post this on social media. So if you want to share with any friends or other colleagues that want this information. So again, thank you to our panelists and thank you to all of our participants. And I hope everybody has a good evening.